Hi everybody, welcome. This is our Health Happens Weekly Facebook Live show, and we are here to bring you objective, unbiased education and information about all the things that you want to know about regarding your health. Health is so important, and we know it's happening every day, all the time, and it happens a little bit differently for everyone. And so please feel free to ask us your questions. We are joined today by Dr. Sarah Wettergreen, and we are really lucky because we're going to ask you a little bit about your training, but she is a PharmD. We're here at the School of Pharmacy, Skaggs School of Pharmacy. And we're going to talk a little bit about today. This month is Immunization Awareness Month. And so today we're going to talk about our favorite topic, HPV vaccine.
Yes, the Gardasil 9.
There you go. See, she knows everything. And last week we talked about the pneumonia vaccine and learned a lot about that. If you missed it, it's on Facebook. It's on our webpage, 9healthfair.org. So go ahead and check that out. And today we want to dive in a little bit and talk about this kind of a hot topic. You told me something really interesting before we went on, which is this is the only cancer that's preventable by vaccine.
Yeah, so most of our other vaccines target things like infections. When you think of influenza vaccine or the pneumococcal vaccine, which you've heard about so far, and even the shingles vaccine, they're more preventing those types of infections. Where with this, we are ultimately trying to prevent someone from getting the HPV virus, which is a virus. However, it does have a risk of related to cancers. So various types of cancers, even for men and women. So this is the only vaccine right now that's preventing cancer.
Okay, that's a really good start. So stay tuned. We're going to dive in and talk all about it. Again, if you have questions about this, because there have been some changes to the vaccine from what we understand. So we're going to get into that. But first, I'd love to hear a little bit about your background. So what qualifies you kind of to know all of this? You are a PharmD. That means, tell us about your training.
Yeah, so I completed 2 years of residency training. The first was a general pharmacy practice residency, mostly in the inpatient setting, some outpatient setting as well, and that was at the VA in Houston.
This is after your schooling.
This is after my schooling,
your schooling included...
So I got a bachelor's degree and then a pharmacy doctorate and then 2 years of residency. And my second year really focused in the ambulatory care setting, which is primary care. So where patients usually see their primary care provider, those are the types of clinics that I now work and practice in.
Yeah, so I think people don't realize that you actually have a lot of the knowledge and the background, and we can ask you a ton of questions.
Yes.
And people like you, PharmDs, are available at some of the pharmacies around town that you go to all the time, and so you can actually use that as a great resource. They're really available.
And I think a lot of patients think of their pharmacist for medication-related questions, but vaccines are definitely an area within our pharmacist scope that we're very knowledgeable. So going into your community pharmacy is a great place to access a pharmacist. And when I work in provider offices, I provide a lot of recommendations related to vaccines. So it's definitely something that we know a lot about.
Yes. So we're gonna dive into it. So first, explain to us what is HPV and how would someone know if they actually had that disease or virus, you said?
Yeah, so HPV stands for the human papillomavirus.
Easy for you to say, right? So HPV, let's just call it HPV.
We'll call it HPV from now on.
Yes.
So that has 150 different types of this virus. And only some of these are known to cause issues like genital warts and these cancers. So when we think of HPV, we're really thinking of some of these specific types that have those risks associated with them. The way that patients typically know is most people actually don't have any symptoms if they have HPV. Unfortunately, so they don't know if they have it and if they're able to spread it to others. But if they do have symptoms, typically the first thing that they'll see is warts, genital warts, and then other type of complications can come later, things like cancers that they may be screened for routinely by their provider.
And you say a lot of people are affected by HPV, the virus.
Yeah, so it's estimated that about 80% of people will contract HPV in their lifetime.
That's most of us.
That's
80% is most people.
Exactly. So the good news is that most people will clear the virus over about a 2-year time frame. So when it starts to be concerning is if that virus is staying in the body for a longer amount of time and has time to have some of those risks occur, like development of cancers.
And so how would we know if we don't have symptoms and the virus is in our body? are there screenings? What is that like? What our annual exam show that for us, or how do we know?
There are some tests that can be done. So usual cervical cancer screening or a pap smear is a way that for women would be able to tell that. And men, it's a little bit more difficult. So we're more looking for that presentation of any genital warts type of issues to come up. But certainly if there are any concerns or complications that they're worried about, it'd be best to talk to your doctor. And there are some other lab tests they can be done to see if they have HPV in their body.
Okay. And so one of the things that we talk about is the vaccine.
Yes.
So there is a vaccine, and you get it when you're a young person. Is that right?
Ideally, yes.
Ideally.
So the vaccine is called Gardasil 9. 9 means it has 9 different subtypes of the vaccine. So there's different viruses. Oh, let's see. We have this little vial.
That's the Gardasil
9. So
look how little it is.
It's very tiny. Yeah,
That
it's a very
means-
small dose. So a small amount of
That
liquid.
means it's not hard to get. It's super easy, right? Is that what
super
that means?
easy to get. You
Okay.
can get it in your community pharmacy. You can get it at your provider's office. And so this vaccine has coverage for 9 different types of HPV.
Okay.
And the types that it covers are those that are most likely to have some of these complications. So there are previous vaccines that only had 2 to 4 different types, and those were the most common. So you don't necessarily need to get this new vaccine if you already had that previous vaccine.
Okay, good
But
to know. So
it does have 9 different
This is a new
types.
vaccine, but if you already were vaccinated, you're still okay.
Right. Yep. So it's not recommended right now, or there's not recommendation to repeat with this new version for the general population if they received the prior vaccine.
So what age should a child?
Yeah. So the ideal time frame to get it is around 11 or 12
Okay.
years of age for both male and females. So the reason we have that younger age is that we ideally want this vaccine in the body before a person becomes sexually active and has any of those exposures. So you can get it later in time, but if you've had exposures, it can't prevent any complications from what you've already been exposed to. It can only protect you from getting future viruses.
Okay, so the sooner or at 11 is better, but you can get it later on.
You can.
How late can you get it? Like, what's the top age?
So it actually was recently extended. So the top age used to be 26 years of age, and now it's all the way up to 45.
All
in both
the way
males
up
and
to
females.
45.
Yeah.
Some of us are old.
Really young
than
45
that,
is what I mean.
So okay, so 40. It's ideally at 11 to 12, but you can get it even if you're up to 45.
Later in life, yes.
Later in
So
life.
per the recommendations, usually up till age 26 is when we have that standard cutoff recommendation. When we get above age 26 up to age 45, it's more of a shared decision-making process with your provider. And what that means is we're thinking a little bit more about patient-specific risk factors. So if you're someone who's in a committed relationship and you don't expect to have any future sexual partners in your lifetime, then you're not someone who's at risk of having new exposures to HPV. But if you're in a different situation and you think you might have new exposures in the future and you haven't gotten the vaccine in the past, it's something you can consider.
Okay, good. That's a good to know. All right, we have a question, so we're going to answer this
great.
question. Go
So
ahead.
Jen asked us at the start, but I wanted us to get into the vaccine a little bit.
Yeah.
She asked, how does it affect our daughters long term? So she said daughters, but how does it affect kids long term? I'm not a big fan of the unknown when it comes to my kids' health.
With the vaccines
Yes.
or with
Yeah,
With the vaccine.
Yeah.
How does the vaccine affect kids' health?
Yeah, and that's definitely a great consideration to have knowledge about these vaccines before they're given to yourself, or especially when you have kids, you want to make sure what you're giving to your kids is safe. The great news about the HPV vaccine is that it's very safe.
Great.
Usual side effects are a little bit of pain in the arm where it was injected, maybe a little bit of redness or tenderness. They might get a little bit of a fever for about a day or so as their body builds that immune response.
Yeah.
But other than that, there's no long-term complications.
Yeah, and those symptoms are usually, does everybody experience those, or does just a few people,
Yeah,
do you know what I mean? I think that not everybody maybe
Not
experiences
everybody,
it the same way.
I think most people might have a little bit of the arm soreness just from having the needle go into their arm. It goes into the deltoid of the arm.
Okay,
the
she did
muscle
say
here,
needle,
but
it's really worth it. It's so
Yes.
small, and
yeah, it's a very small needle. It's like a little prick. So if
Yeah.
you've ever been stung by a bee, it's easier than that. So a very
Yeah, 'cause-
quick vaccine.
Okay.
But long-term complications are rare, if any, and then those more concerning side effects, even like the fever or the immune response, are not in every patient.
Yeah. And they've been studying it for a long time, this vaccine.
Yes, exactly.
So
Yep.
they do know longitudinally what the results are.
Yes, and so some people get concerned about some of the other ingredients that are in vaccines, but we've shown them to be safe in long-term studies of people who received these vaccines a long time ago or had those exposures in other ways, and it's such a small amount, so the risk is very minimal.
Yeah, very good. Okay, we have
Yeah.
more questions?
Well,
Great.
someone had just said that they had students get sick from the vaccine, so maybe you can address like if it's even possible to get sick from the vaccine, or maybe they had something else going on.
So can you get sick when you take this HPV vaccine? Is that
So
even
the
possible?
vaccine is inactivated, meaning that it's a dead virus. So
Okay.
you cannot be infected with the virus from getting this vaccine. The only thing I could think of is maybe with feeling sick could be some of those lingering effects right after getting the vaccine. So if they had those symptoms of a fever or that immune response where you maybe just don't feel as great for about a day or so after getting the vaccine, that might be the only thing I would think about in terms of sick symptoms.
Right. So it is possible to feel a little not just up to
Great.
par.
And that's true with most vaccines. So anytime you get a vaccine, your body needs to build an immune response to that vaccine in order for it to be effective.
Right.
And so when you have that immune response, it feels sort of similar when your body has an immune response when you're sick. So that kind of grogginess you feel when you have a cold and just a little groggy maybe and down that day, those types
Yeah.
of things can happen when you get vaccines,
Yeah.
but only for about a day or so.
Yeah.
If it is anything longer than that, it would be worth following up with your provider because it's likely due to something else.
Got it. Okay, so and it's important to know that what we're really doing this for. So you may have some discomfort or whatever, and it might involve a needle, but why are we really doing this vaccine? Because what are we preventing?
And that's a great point, is we've focused on the risks a little bit, but we're really trying to target those benefits. And those
Right.
benefits are intended to outweigh the risk. So by getting this vaccine, you can prevent the complications related to the HPV virus. And those types of things are cancers. So
Right.
oropharyngeal cancer or cancer of the mouth and throat are the most common types of cancers. But it also is a risk for cervical cancer, anal or penile cancers. So
Okay.
there are a lot of risks associated with that.
So oral cancer is the most cancer that usually occurs if HPV is not treated, is that right? Or not prevented?
It's more if someone were to get HPV, you can't really treat it, but if you didn't prevent it with the vaccine.
Gotcha.
So those types of risks can certainly happen. And so it comes from that intimate sexual contact when they have risk. So wherever that exposure may have happened, that's where we're seeing more risk for those cancers. And so in some countries where they have higher vaccination rates and more people completing the 2 to 3 dose series of the vaccine based on their age, we're seeing places like Australia almost eliminate cervical cancer because they're having so many people with the vaccine that their rate of cancer is dropping dramatically.
That's really good. So that's what's possible. When
Yeah,
we
so
get
that's
a
the
vaccine.
end goal is recommendations are to have over 80% of people receive all complete series, so either the 2 to 3 dose series depending on their age. And right now in Colorado, we're about 50% of people are getting their complete series.
So we have a
that
ways to
leaves
go.
people at risk. Yes,
Yeah, we have
absolutely.
ways to go. And you were telling me earlier that you're actually protecting other people as well when you get vaccine. How is that possible?
Right, because you're definitely worried about your own risk when you have intimate contact and might contract something like HPV. But then if you have a future partner, you might spread it to someone else as well. And so in some individuals, they're able to clear the virus and not have any complications, but that's not true in all patients. So if you were to contract it and clear it later, but you gave it to someone else who wasn't
Without
able
any
to
symptoms,
clear it,
you wouldn't necessarily know you
wouldn't
have
know
it.
because
Yeah.
you don't have any symptoms.
Yeah,
That's
yeah.
right. So most people who have it don't even know.
And 80% of us have it at some point.
80% do at some point. So odds are that
I was listening.
most people would be exposed. You were, yeah, definitely.
So 80% of us have it at some
Yeah.
point, and we probably don't know it.
Probably don't know it. You don't
And you
get
could
symptoms.
be spreading it.
You might be clearing it, or you might be spreading it. It's
Yeah.
really hard to know early on.
Yeah.
And so a lot of the testing for HPV, especially in women, doesn't happen until even later in life because younger women are known to typically be clearing that. So unless it's lasting in their body a long time, that's when we start to be concerned about those complications.
Okay, good. Oh, we have a question?
There's just
Okay.
a couple comments again about
Sure.
all this, mention all the side effects and all the ingredients. So if someone's just joined us, maybe just kind of
Yeah, so if you have the question, what's in these vaccines, are they safe? We're going to go ahead and address that now. And again, we're joined by Dr. Sarah Wettergreen, and she's a PharmD here at the Skaggs School of Pharmacy. So she has all the training and the studying and the research behind her to be able to answer these kinds of questions, because there are very many questions. People still think that there's something in these vaccines that's not good for me. Tell us, is that true?
No, so the components are actually things that we're exposed to in daily life. So I think it's fair for people to ask questions and want to know more about what's in the vaccine, because anytime I put something in my body, I certainly want to know what's in it and make sure that it's safe. So one ingredient that people get a little nervous about, or they read mixed things on the internet about, is aluminum. So aluminum is in some vaccines. It's used as an adjuvant, meaning that it helps the immune system develop a response so that the vaccine works well.
Okay, so aluminum, like the aluminum foil.
A little bit, yeah. So it sounds scary, right? So you hear that and it sounds really scary. This vaccine has about 0.5 milligrams of aluminum. But what we don't think about is that in our daily life, just by eating even healthy foods like vegetables, we're getting about 7 to 9 milligrams of aluminum every day, because there's aluminum in our soil. So if you think about on a daily basis, I'm getting about 7 to 9 milligrams. This 0.5 addition is really not too much. And in those low doses, it's not shown to be harmful.
Okay, yeah, so really we're getting more aluminum in our bodies by eating our vegetables, like green beans.
Yeah, even I always compare about a cup and a half of green beans has the same amount of aluminum as this vaccine does. So if you're willing to eat green beans at about a cup and a half, which is a good portion size, that's going to be the same as getting this vaccine. So we shouldn't be too worried about that component.
Okay.
Another one that people get a little worried about is one called Polysorbate 80, which sounds really complicated.
I can't say that.
So it's basically in the vaccine to help prevent it in the process from getting any foam type of thing. Other places we see this used really commonly are things like pudding and ice cream.
Oh, well, we eat those. We like those.
Yeah, and even those have over 10 times the amount of that polysorbate compared to what this vaccine would. Okay. So if you're willing to eat ice cream at a different chain restaurant outside of your home, a lot of those have polysorbate. You
mean if you didn't make it yourself, right?
You didn't make it yourself, and
if you bought it.
If you knew it was just milk and cream and sugar at home, that's one thing. But if you're willing to buy ice cream outside from a shop, like a soft serve cone, it's going to have way less in this vaccine of that ingredient than ice cream would. Okay.
Are there any other ingredients we should be understanding or worried about? Or
those are the main ones that we really think about. There's a couple others that are very small in amount and aren't things that are concerning usually.
Okay. Yeah. So this brings up the question for me is there anyone who shouldn't be getting this vaccine? Is there people that just, it's not appropriate for?
That's a great question. You could take it a few different ways. So in terms of the people who really cannot get the vaccine, or those who had a severe allergic reaction to any of the ingredients, so like an anaphylactic type reaction where maybe they can't breathe, those types of issues. One component in this vaccine is yeast. So if someone has a very severe yeast allergy, that would be someone who probably should not get this vaccine.
Okay, good to know.
Pregnant women also should just wait until they're no longer pregnant. They can have this vaccine while they're breastfeeding, but if you're actively pregnant, it's not a good time to get the vaccine. It just hasn't been studied in that population. Okay. There's really not urgency at that point either, so you can just wait until you're done.
Okay.
In terms of who's indicated, though, people above 45 typically have not seen as much benefit from this vaccine, and that's why it's really only approved up to age 45.
Okay.
Other people that probably don't need the vaccine anymore are those who do not plan to have another sexual partner or any sexual partner. So if that's not something you're planning in your lifetime, or you're not expecting to have a change in partner, it's not necessarily something you'll need at this point.
So if you're 45 and over and you're in a one relationship, a committed relationship or whatever, then you probably don't need to consider this vaccine.
Right.
But what if you're in that population where you might be over 45 but still in maybe having different sexual partners for whatever reason? Maybe you're divorced, maybe, whatever it is.
Yeah, that's definitely possible. We know that there are people who live their lifestyle, and that's completely fine. Unfortunately, this vaccine is only approved up to age 45. It has not shown demonstrated benefit above that age at this point. So what I'd recommend is typical protective practices for people above 45, and then certainly if they have any symptoms of genital warts or any other concerns, definitely follow up with their provider.
Yeah, probably regular screening for other things too would be appropriate.
Yeah,
so
general
you might as well
health screenings would
put
be a
this
good idea.
Yeah. So we covered almost everything. Is there anything we didn't cover cover that you want people to know about this vaccine? It seems really important. If we're at 50% and we want to get to 80%, what's stopping people?
Yeah, one other thing I would say is that in Colorado and other states, we see quite a few patients who do not complete the series. And so they're not having that maximum protection. They might have some level of protection, but not that full protection.
So tell me about the series. If I'm 11 or 12, or my daughter's 11 or 12, she has to have, or he has to have...
2 doses. Yep.
2 doses.
So if you're under age 15, so the starting age you can start to get it is 9, ideally 11 or 12, but up to age 15, only 2 doses.
Okay.
Now that's the disadvantage to procrastinating here, is if you wait until after you're 15, then you need a 3-dose series.
And it's 3 shots.
3 vaccines, yeah,
Okay.
3 different times. So they're spaced out in different intervals.
Okay.
So what happens then is a lot of people will just get that first vaccine and not...
I can see that.
Yeah, not go back and get that second or that third to complete their series. So it's really important to complete the series to get that full protection and benefit.
So both things are happening. People are not getting vaccinated, right? Because maybe they don't know how important and how good this is.
Yeah.
And then the second thing that's happening is people are not getting the full series.
Yes,
Yeah.
exactly. So
Okay.
people are missing the vaccine, and overall in the nation and in Colorado, we see lower vaccination rates in our rural areas.
Okay.
Some of that has to do with access. So I always like to remind patients that you don't always have to find a provider's office to go to. You can get this at your local pharmacy.
That's a good point. So that it's easy to do.
Yeah.
You don't have to wait till your doctor's appointment or
You don't have to go
provider.
in and pay the copay. You always can, especially if you have other concerns or you're there for a different reason or your annual exam. You
Yep.
can get it at that time. But if you missed it at that visit or you got your first vaccine then and you want to complete your series, you can do that at the pharmacy.
Okay, really
Yeah.
great. I think this is a lot of information packed into here.
It
so,
is, yeah.
We appreciate your breaking it down for us and really answering all our
Absolutely.
questions. It is Immunization Awareness Month, so this is one of the immunizations, I can say that, we wanted to bring to you. We've talked about shingles, we've talked about flu, and this is another important one, the HPV vaccine.